Huh?
You're live.
Okay. All right, is everyone ready? I think Audrey's going to turn the music off. So we'll start after that. Okay, so today we're going to be talking about blood flow. Well, first of all, let me introduce myself. I always assume people know me, but that's not a good assumption. My name is Amber. I'm a physical therapist at Benchmark here in Jefferson City. This is Audrey. She also is a physical therapist at the same location. We both have our CFL1, so I think it allows us to work very closely with CrossFit athletes, specifically from a rehabilitative standpoint. But we also occasionally do screenings and treatments here, and tonight we're leading the seminar. We've done this a few times in the past, and tonight we wanted to bring some information in on blood flow restriction training. Pretty popular tool nowadays. Recently, it's a pretty new tool. I will say it's used in a lot of different settings. Bodybuilders, CrossFitters. There's a lot of different ways that you can use this tool, but tonight we're going to be speaking specifically from a rehabilitative standpoint. Okay, so when there's an injury, you come to us, hopefully, and then we teach you how to use this to help get you back or meet your goals. So first, let's define blood flow restriction training, because there's a lot of us in here that don't even know what it is. BFR, that's what we're going to call it for short, because I don't really want to say it multiple times tonight, is defined as the brief and intermittent occlusion of both arterial and venous blood flow using a medical grade tourniquet while at rest and or exercising. So BFRT allows us to exercise at significantly less resistance while still working towards strength adaptations, okay? So I got a question, and this is not rhetorical. That means you answer it, right? Okay. So the question is, what does it take for an individual to adapt to exercise demands? Okay, so I realize that this isn't very specific, so I'm going to specify it a little bit. Who can tell me at what percentage of our 1 rep max do we have to work at in order to see strength gains, whether that be like getting stronger or muscle hypertrophy? Anybody want to yell out a number? Bryce? 75, 85. Okay.
45.
Okay. 1.
This is the Price is Right.
Yes. So, okay, it's actually 65%, 65 to 70, okay? Because remember, this is just any strength adaptation. This is not like setting a PR or anything. That's not maximal adaptation, just the minimal adaptation, okay? So 65% is what we have to stimulate our body with to get stronger. Okay, so I don't like reading through a lot of writing on PowerPoint slides, so we're gonna make a graph. Okay, so there's 2 terms on this slide that I want to kind of break down, okay? Capacity and demand. So we're gonna make, I don't know, what kind of graph is this called? X-axis, x-axis, the line, whatever, yeah. I didn't learn that.
What are you going to do on it? Because that's going to determine what kind of graph it is.
Don't worry, I know how to make it. I just don't know what it's called. Okay, so y-axis is our capacity, meaning what our body is capable of, okay? And then the x-axis is going to represent time, okay? So everyone has a capacity, right? Like even the 95-year-old that's in the nursing home who is there for just like general deconditioning and can't take care of himself. He has a capacity. It might be terrible, and probably is terrible if he's in the nursing home, but he has a capacity, okay? So let's say you start CrossFit, right? We have somebody sign up to come into our gym. Their capacity may start somewhere down here, right? Over time, we want to see the capacity grow, right? We never just come to the gym not to get better. So we want to see there be linear progression in our capacity. We do that. Pink is going to represent that second term, demand, okay? So thinking of the 65% stimulus that we have to place on our body, right? Demand always stays under capacity, okay? So if we're consistently applying that 65% stimulus to our bodies, our demand is going to push our capacity forward, right? Does that make sense? Okay. Now, let's say, I'm going to take this away. That's a beautiful, consistent progression towards our goals. Let's say that person that just signed up for their CrossFit membership, okay, they get super excited. They start doing 2-a-days. Or they start lifting way more than they've ever lifted in their life. They start progressing the load way quicker than they should. Now their demand is exceeding their capacity, okay? What do you think happens here? Yeah, okay, good. I am making sense. Cool. Yes, so a lot of times, not all the time, but a lot of times what we will see is we'll see somebody come in with an injury and we'll have to assess their training volume. Did it ramp up too quickly? Are you doing just too much in general? And that's where we see an injury come into play, okay? So when we get injured, blue is capacity. Okay, when we get injured, our capacity significantly, I should probably not draw that going forward, sorry. So significantly decreases, right? Now we cannot do as much as what we were doing prior to our injury. But remember, this doesn't go away just because you're injured. So do you think that if we're still working out down here and still applying somewhat of a demand to our body, that we're actually going to get stronger?
Yes. If it's 60, no, that's not if it's 60.
Yeah, exactly, right? Because remember, this is our original capacity. So if we're down here, we're never meeting that, right? We have to get here to get stronger. So what happens a lot of time in that situation? You get injured. You might go to the doctor. You might come directly to us. Hopefully when you come to us, this is not what you're going to be told. But let's say you go to your doctor, right? They don't understand CrossFit. They just tell you, oh, you need to rest. Or even worse, they may tell you, you don't need to be doing CrossFit at all, which that's my least favorite answer. So that's never the right answer, by the way. So traditional care in that situation is go home, rest, ice, elevate, right? All the boring things. Maybe you'll get a script to come to physical therapy to where, you know, typically you would maybe see traditional PT care where you come in, we use passive modalities, we might do some manual therapy, we might dry needle you. If we get real crazy, we might use some light resistance bands, right? But we know from research that low load training does nothing to our strength, right? Because it has to be at that 65% stimulus for us to get strength gains. It only takes about 10 days of rest to notice regression in that curve, okay? We don't want to do that, right? So this is where blood flow restriction has really made a play in the rehab setting, okay? So we can now utilize blood flow restriction training to still get stronger while working under less of a load. Does that make sense? I wanted to just kind of go through that because that is ultimately how blood flow restriction training works. So we're gonna demonstrate this tonight on Brooklyn. Brooklyn has volunteered. She's never had blood flow restriction training done before, so she's gonna be, she's not gonna be biased or, you know, kind of know what to expect, which is gonna be great. And then if there is anybody that wants to try it, we can spend some time after demonstrating on Brooklyn going through that. I will say there are some contraindications, okay? So I don't think anybody in here, I know most of y'all's medical history. So I think we're safe, but we will just kind of screen you on that front just to make sure that we are safe to do it on you today. But whenever you come to us, okay, if we're thinking that this is something that we might want to add into your plan of care, again, it's a tool. It's not the end-all, be-all. It's not going to fix everything. It's just a tool that we can add in if we think it's beneficial. We're going to roll out those contraindications. We may want to clear you with your medical doctor first. And then we're going to determine which area needs to be treated, which movement are you limited with. Is it your bicep curl, which we don't really do a lot of in here, so. Is it your triple extension in your pull, right? Is it squatting? Is it hinging? What type of movement patterns are affected because of your strength limitation? And then we're going to discuss whether or not it is beneficial for your goals. So, does anybody have any questions before we get started? Okay, Brooklyn? Okay, so this is just kind of like the standard exercise protocol, okay? So, we're gonna say, this is basic, right? But we're just gonna keep it simple, just so y'all can kind of experience this. We're gonna say that she has a bicep strain, okay? Which is now affecting her, what's a good movement that we need bicep strength for? Reverse, yeah, there we go, pull-ups, perfect. She can't pull up because her bicep's strained. So, we're gonna apply the cuff. First of all, any medical history that I need to know about?
I don't think so.
Okay, perfect. So there's two places that we will put this, okay? It's very simple. If we're treating an upper extremity injury, we're gonna apply it proximally to her shoulder to cut off that brachial artery, right? If we're treating a lower extremity injury, we're gonna apply it very proximally to her thigh to cut off the femoral artery. So those are the two main arteries that we are occluding.
I don't like that sound.
I know, right? Normally we like to keep blood flowing. So this was, okay, I almost put that in here, Deb, but then Kevin was like, nobody really cares, so.
We should make an Instagram showing.
Yeah, I know, right? It was, it's like the Japanese figured it out.
They always figure it out.
This guy, he was like in a, I think what's called like a tsetse pose, where he was praying. So his foot was being occluded. Well, he had a fracture, like he had a fracture that he was working through. He got up and he did some strength training under that occlusion, and he noticed that he was stronger. So, yeah, so goes back to that. Okay.
He was attending a Buddhist festival.
Do you feel like getting tight?
A little bit.
Okay. Very tight? No?
Not like a blood pressure. Just keep it
Okay.
or anything. That's pretty tight.
Okay, perfect. Okay, so standard protocol is hold on. We're treating your bicep, okay? So we're going to work through a set of 30, rest for 30 seconds, a set of 15, rest for 30 seconds, a set of 15, rest for 30, a set of 15, okay? First set of 30, and this is, so you're just doing some bicep curls with no resistance, right? Because this is where we can work without resistance and still meet our strength goals. So for your first set of 30, this should be fairly easy. We should start seeing some fatigue in this second and third set though, okay? So all you're gonna do is go from end range extension all the way through your range of motion to do a bicep curl. Yep, 30 times. Now, if I get, just count. If I get to, and then will you count to 30 when she finishes? Perfect. If I get to like the second, and definitely by the third set, and she's not fatigued, I will load it a little bit. So I'll give her a dumbbell. Again, it doesn't have to be like a 35-pound dumbbell, but something light, again, just to further the load a little bit. How you feeling? Feel okay? Do you feel some burning? Okay. It is crazy. Like, you wouldn't think that it's doing anything, but it is very challenging. So, okay, if she's counting to 30, we're going to work. Okay, well, perfect. Perfect. And then, I guess I should mention this. If we get to a set and she's just like, I just can't go anymore, we're going to decrease the pressure, okay? But still trying to keep the consistency in the load. How? Okay. Really? Are you okay? Did you also fracture your finger? Okay, so fracture is also a contraindication, so Leslie, you're out.
On that one?
I'm not. Okay, let's just, for fun, let's just see what the 3-pound feels like. Wait for the 30.
So if she doesn't have an injury, will this still?
Yeah, absolutely. Well, okay, so, let me back up. That's where the research is conflicting. Like, there's really good research to support using it when there's been a change in the physiological state of that muscle, either through injury or, if you just have, like some people just have weaknesses in certain areas, right? Like imbalances, things like that we discover. But for somebody who doesn't suffer from those things, the research doesn't really support using it. And I don't want to get into that because I know that there are a lot of bodybuilders and people that are just strong that use it for other reasons. So I guess in those situations where I don't know the answer, I just say ask them, like what's their belief? Where are they getting their evidence from to support use? But in an injury setting, this is how we would use it. So it works really good for and sometimes it's not injury, sometimes it's overuse, or well, I guess that is an injury, but like tendonitis, tendinopathy, things like that, that's holding you back from progressing in the gym. It's good for those types of conditions as well. So, how are we feeling, Brooklyn? Is this your 4th set? Okay. So, how would you describe what it feels like? You good?
Yeah, it hurt.
It hurt?
Yeah.
Like how did it hurt?
I don't know if it hurt me in the way it's supposed to, so.
Oh boy, okay. Did it feel heavy?
Kind of. I didn't feel muscularly fatigued.
Okay.
It hurt my joints.
So, okay. Well,
I don't know.
Sometimes too, I think it's good. Like last night I was testing it on Kevin and I was having him do it with the side that we weren't occluding, and I think he noticed more of a difference too. Another thing to consider is weight-bearing positions are sometimes going to be more effective, which we know just in general for strengthening. So thinking about push-ups, squats, closed chain exercises, but just for demonstration purposes, I wanted to keep it simple. So good job. Thanks. Okay, so that is really all I have. It's pretty short, sweet, simple, to the point. Does anybody want to try it out? Or?
I have a question. Can we just do that with you? Or,
With what?
is blood flow restriction training something that really is done in the morning, or is it something that we should do here?
It can be done in other ways. From an injury standpoint, I would recommend doing it with a professional, because we are occluding blood. So we want to be sure that that's done so in a controlled way. So, yeah. All right. Yes.
Is the tourniquet always to be applied high on the extremities? So even if it's an ankle, it'll be applied high?
Yes. There's only 2 places that we apply it. So here and here. And that way you can work anything distal to the application of the tourniquet. Okay, here we go. We're rolling now.
You can imitate the same thing with flossing.
So, okay, that's another, yeah, you don't have to have this is just a company that we use. But you can use, there's electric cuffs, there's just tubing that people use. I don't know enough about the flossing really to tell you, because again, we're determining this via a protocol, how much occlusion is applied. I pump it up to 100% and then I back off until I can kind of start feeling the arterial blood flow again. So we're not exercising at full 100% occlusion, and this equipment allows me to figure that out. So I don't really know how using just tubing allows you to do that. I just don't know enough about that style.
So the floss is a little bit more just myofascial release. So when you do those movements, it's causing a breakdown of the damaged tissue, and then when you re-engorge, the blood wipes that out. Well, you're targeting a specific thing versus a general area.
Sweet. Cool. You want to try? Okay. Go, Deb. Go, Deb. What do you want to try? Do you want to try?
I have a spot on my leg when I had hysterectomy, they hit the nerve or something. So it's I have a spot that's kind of deadened and it's spreading.
Oh, why don't we do this then? Okay.
Or
Why don't we?
I'll do whatever.
We'll just do, just keeping it simple. We'll put it on your hip.
Okay.
And then I'll have you sit on the edge of the box and we can just do some leg raises. Okay? Okay, so yes, thank you, Audrey.
It's not arm.
Okay, so have a seat. Well, actually, don't.
Just kidding.
I'll apply it while you're standing.
This
This
the
one?
back leg, yeah.
So I have to get up there. No history of blood clotting or anything like that, right? Okay, hold on. Okay, woo, almost fell into.
Don't fall.
Okay, do you feel pressure?
Yeah, feel some pressure.
Moderate.
Yeah, it's moderate to firm.
Okay, go ahead and sit up here then. I know, right?
Grace is not my middle name here.
And bend your knee. And so then I would have you just go through the same protocol. So we're going to go up and down 30 times. Yes, I'll get this out of your way too. All the way through full range of motion.
That's just full for me.
Okay, yes, 30 times, okay? I mean, she did.
It really makes a difference.
You did deadlift how much?
215.
She's a beast. Let's go.
Yes, and then I had missed a month of workout and 3 weeks. 3 times a week, fast food, and it's fly back in.
That's why I'm back
I
here.
think I lost count.
Oh no.
I guess-
Okay, Russ. Do you have a timer going? Thank you. It is. Especially when you're working with me, because then I talk to you. Your nails look so
It
good.
started here, and then and it'll ache just when I stand on it or something during the day. And that's what but there's no blood clots, there's nothing. It just hurts. But it doesn't hurt me when I'm working out because I'm moving.
Yeah. Weird.
15? No, 30?
15. Slow down the knee.
Long 30 seconds.